Hello everyone, welcome to our YouTube channel The Meds 5. Today we are going to learn about the shoulder joint. So what is the shoulder joint? Shoulder joint is the joint which connects the upper limb to the thorax. The shoulder joint is a synovial joint of ball and socket variety, in which the head of the humerus acts as a ball and the glenoid cavity of the scapula acts as a socket. The articular surface of the shoulder joint is formed by the glenoid cavity of the scapula and the head of the humerus. Therefore, it is also known as the glenohumeral articulation. Now, let's see the ligaments supporting the shoulder joint. The capsular ligament, the coracoacromial ligament, the transverse humeral ligament and the glenoid labrum. Now, let's understand each ligament in detail. First is the capsular ligament. The capsular ligament is very loose and therefore it permits movement. It is lined by the synovial membrane. Medially it is attached to the scapula and laterally it is attached to the anatomical neck of the humerus. Anteriorly, the capsule is made strong by 3 supplemental bands. Next is the coracohumeral ligament. It extends from the coracoid process of the scapula to the humerus. To humerus, it is attached to the neck of the humerus. Next comes the transverse humeral ligament. It acts as a bridge on the upper part of the bicipital groove. Next is the glenoidal labrum. It is the fibrocartilaginous rim which covers the margin of the glenoid cavity and therefore it increases the depth of the cavity. Bursae related to the joint. There are 3 bursa. The subacromial bursa, the subscapularis bursa and the infraspinatus bursa. Now let's see the relations of the joint. Superiorly it is surrounded by coracoacromial arch, subacromial bursa, supraspinatus deltoid. Inferiorly, long head of the triceps brachii, axillary nerve and the posterior circumflex humeral artery. Anteriorly, it is surrounded by the subscapularis, the coracobrachialis, the short head of the biceps brachii and the deltoid. Posteriorly, it is covered by the infraspinatus, teres minor and the deltoid. And within the joint, it has tendon of the long head of the biceps brachii. Blood supply of the joint. It is supplied by the anterior and posterior circumflex humeral vessels, the suprascapular vessels and the subscapular vessels. And the nerves which supply the joint are the axillary nerve, the musculocutaneous nerve and the subscapular nerve. It permits movements like flexion, extension, abduction, adduction, medial and lateral rotation and circumduction. Let's see the clinical anatomy related to the shoulder joint. The shoulder joint is dislocated inferiorly. The shoulder tip pain. It is caused by the irritation of the peritoneum which lies under the diaphragm which causes referred pain in the shoulder. Thanks for watching. Please don't forget to like, share and subscribe our channel.